We have heard many stories of how the pandemic has left businesses scrambling to hire workers. We know hospital staffs, for example, are overworked and stressed by this latest surge of COVID cases. Tonight, we take you inside a special home. The teenagers who live there depend on adults for everything, 24/7. But sadly, the staff is overworked and struggling to keep up. It's a story new at 6. It's a home in a Lexington neighborhood.
We try to make our homes as much as a home setting as possible. A lot of our kids come out of hospitals.
From the outside, there's nothing that sets it apart.
And when they come to our program, we want them to feel like they're in a home as much as possible.
Inside, you immediately notice fun play areas, loads of children's books, games. A child's bedroom looks fairly typical.
They're just like all the other kids. They just want to be loved. They just want to be taken care of.
There are also signs this is different.
Well, we have like special pillows around in case there's an episode. We have fire extinguishers, which most houses don't have on the walls. Special locks so that our kids are safe.
Our kids. 2 words we heard a lot during our visit to one of 7 residential treatment homes in the Lexington area.
Good job.
Caitlin Sass is a program manager for Key Assets, a company specializing in caring for teens and children under the age of 21 in residential homes, contracted by the state.
Most of our children do have a diagnosis of autism. They all have a co-occurring disorder, mental health disorder.
Good job. So pretty.
A mood disorder, say ADHD or intermittent explosive disorder, different things that would change their behaviors and make them maybe a little bit more harder to handle in a normal home setting.
Taylor Roy is a house manager.
A lot of our kids have to be taught to kind of do the stuff that we just do every day, like brushing our teeth or bathing themselves.
It can be very challenging.
Some of them aren't potty trained, and when they're a little bit older, it's not really fun to change a grown child's diaper.
The children are in the custody of the state. We've agreed to hide their identities.
Some aren't with their families because they've been abused and they've ended up in a hospital setting where they were being taken care of. Some of them, their family just didn't have the right tools to take care of them because of their behaviors.
The homes must be staffed 24/7. Staff workers must be within sight or sound, so it can be very demanding.
Pretty much all of my staff are working at least 1 or 2 doubles a week, and they're getting pulled to all the different houses.
We have staff pulling 80 hours a week.
COVID took a toll on the program staff. Some left and never came back. Hiring has been very difficult, and it's the kids, the clients, who suffer.
It doesn't help with progress when we don't have enough staff to give that direct one-on-one care.
Does it hurt your heart to see the struggle of having this properly staffed?
Yeah, sorry. Because our kids, they're wonderful and they deserve to have the people and the staff around them to take care of them.
Sass says pay has increased for the staff, but a job like this requires special qualities. Ashley Flowers, a therapist, believes in the mission.
Everybody's done an amazing job with pulling together and making sure it works for the kids, because the kids come first, but it's been really challenging to see the stress level and just the exhaustion.
They don't always learn the way that we do. So if they don't have somebody to teach them, then they won't ever know. And I feel like this is the best opportunity for them to be in the community and living in a home for normalcy.
Now, the children and teenagers at these various homes do go to public school. That's a big deal to them. The goal, though, is for them to learn life skills that will eventually allow them to move on into a more independent life. You can contact Key Assets for more information on jobs and hiring.